Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. Well, I hope each and every one of you had a wonderful Thanksgiving. We're getting into the holiday season, and what everybody wants to talk about is that New Year's resolution that includes getting back into shape. But what if you have knee pain that's preventing you from getting back into shape? This week, we're going to be talking to you about all the different treatment options in our approach at Maragal Medical when we're evaluating a patient with knee pain. Not going to want to miss this one, so stay tuned. Okay, Dr. Mike, we get through the holiday season, we just finished Thanksgiving, New Year's comes up, everybody's, New Year's resolution is to eat healthy, get back into shape. But one of the more common complaints that we see in our office is patients with knee pain, often from arthritis. So what makes our clinic so much different in our approach to treating a patient with knee pain?
Well, if you think about the holidays in general, we overeat for a while, but then we want to get back going. We have this New Year resolution all the time, getting back in. But if you think about the movement or the lack of movement for a while is really what we think about in a sense of arthritis. But here we really look at the whole body. We really want to take in, someone complains of knee pain, is it coming down from their hip or coming through their back? So we're really looking at a full body approach. If it's your knee, most commonly lower back down to your legs, but we are really looking at the whole body in the sense of ability to move or the difficulty of movement. So we really want to focus in on a little bit of all this aspects of movement, activities, to really get a good understanding of what really is causing the arthritis. Then we'll look at the arthritis in the sense of x-rays, get the pictures, and do all the appropriate workup to really focus in where the problem may be.
Yeah, and with our approach, since we're combining medical care, chiropractic treatment, and physical therapy, we really get an opportunity to treat the patient as a whole. So, the chiropractic treatment, the chiropractor's area specialty is keeping those joints moving. And not just the joints in the knees, but all of the corresponding joints. If you're not walking correctly, obviously the joints in the lower back and pelvis need to be adjusted to make sure they're moving in a more normal pattern. Physical therapy, we've got a great robotics technology. So, my wife Colleen, her expertise is going through a thorough evaluation, making sure she's identifying where the patient has some weakness, some imbalances with flexibility, obviously core strength and posture, but also their movement patterns and their balance. And she has the ability to use this, cutting edge robotics technology to put together a very detailed, treatment plan to make sure patients are getting the best care possible. But there's some other services too, simply like an offloading knee brace. How does that come into play?
Well, if you think about it, and people have commonly understood that if you have bow-leggedness or knock-kneed aspects, it really is a breakdown in the joint, one side of the joint versus the other. So the knee actually becomes deviated.
Yeah.
There's a little bit of angle to it in one way or the other. The offloading knee brace allows us to put some force to get the alignment as best we can. If you think about it, if your knee is getting a little bit out of the line, that's throwing off your mechanics of your hips and your back. That's why we need the services. Again, with our machine, we have ability to use a sitting position or a standing position, and then taking that pressure off the knee really makes the exercise and the therapy more productive and more efficient. So that's what we're really looking at, the aspects of using bracing, using the alignment aspects of our services on the therapy, the chiropractic, and then the aspects of treating that arthritic joint. It kind of gets it all together in one spot.
Right, and one of the big things that we notice is that abnormal walking pattern. So we even take it one step further. We got this cutting edge technology where we can actually accurately measure the arches in the feet to make sure that you're getting the appropriate support. Our feet are our body's foundation. We use, Foot Levelers Orthotics. They've been making custom orthotics for about 70 years. Another piece of the puzzle to make sure we're addressing the patient as a whole. In terms of pain relief, well, in our clinic, we try to look at holistic options. So, one of the more common things that I see patients, and I just did an eval the beginning of the week where, this patient, younger guy, was taking, Motrin, a common anti-inflammatory, but he was taking it for a year. So, those anti-inflammatories are good short term, but oftentimes you make the recommendations. We want to switch the patient over to something safer. Class 4 laser really makes a big difference, and accomplishing the same thing, but you don't get the side effects from those medications.
Without question. And again, the idea of using any medicine for the length of time, we understand nowadays the side effects that come into that. Anti-inflammatory or arthritic medicines cause blood pressure elevation, gastritis, ulcers and things. And we all know about that, but it tends to get overlooked. So we really want to make sure I review that, make sure a person is reduced on their medicine or stopped it for a while, use the alternative treatments, nutrition even, just better health diet can make your inflammatory processes diminish. So that's why the bracing, the laser, and the aspects of the exercises is going to help try to prevent those other problems, because we are looking at from the body all the way down to your feet, not just the knee itself.
Right. And then you get the patient that comes in that just saw the orthopedist, they got a cortisone injection, and then if that doesn't work, they've recommended knee replacement surgery. So they're coming to us because obviously they want to avoid the knee replacement surgery, but they have that history of cortisone. So, why is cortisone bad? And then what's the option if you don't want to go through the knee replacement? We've got these great regenerative injections.
Well, certainly the cortisone has been around for a long, long time, and the injection really tries to reduce inflammation. So it is a way to try to avoid medication use, but it really is a short-term benefit only from an aspect of very time restrictive. We look at the regenerative injections that we have offered, between platelet-rich plasma and regenerative, stem cell type of injections. We really can prolong the benefit over many months, and that's the benefit. We really want to get our persons feeling better. Not necessarily a quick fix, but again, getting the aspects of longer term benefit to give us the time to get the exercise conditioning. There's some work on the patient's side, but that's what's going to make it better. And then we can avoid that repeated cortisone, because that's what ends up happening. You get one, we'll let it go by, we get two, and then it still keeps on coming back. You get repeated injections to try to avoid surgery. Then it becomes problematic, and there's side effects to cortisone, especially when you do it too often. And that's what we're really trying to avoid also.
Right, yeah, and those cortisone injections over time can actually, damage the joint even further. And doesn't it make sense to look at a completely safe cellular injection that's going to help repair the damage to the joint? You oftentimes say instead of regenerative medicine, it's more reparative medicine. But equally important, you need to make sure that you're constructing a treatment plan where you're looking at the patient as a whole and identifying the root cause of the patient's problem. If you would like more information about our practice, easy enough, just check us out on the web at maragalmedical.com. And folks, remember, we take most insurances. Well, that's it for today. I hope you learned something. Have a great day, everybody. We'll see you next time.
Bye now.